everybody, welcome back to my channel, or welcome to my channel if you happen to be new here. And if you are new here, my name is Ashley, and today we are talking about the world's expensive shots or injections. I'm talking about Thyrogen. If you are not suffering from any kind of thyroid disorder, thyroid cancer, or anything like that, you wouldn't know what this is, but Thyrogen is an injection that you receive before receiving radioactive iodine, which you would receive if you had thyroid cancer. And if you didn't know already, this video is a thyroid cancer related video. It has been so long since I made one of these. I missed the whole month of October, and my goal was to continue on from Thyroid Cancer Awareness Month in September right into October, and I failed miserably. So here I am back with some more informative videos, and I hope that you guys are ready. So if you want to hear more about the most expensive injections in the world, keep on watching. Now, I'm only saying that they are the most expensive injections in the world because I come from a low-class, middle-class family, and it's a lot of money for us. But if you are like myself and many others preparing for radioactive iodine therapy, you will be receiving Thyrogen injections. Thyrogen is a protein designed to be identical to our body's own natural TSH, or thyroid stimulating hormone. In this video, I'm going to be talking about what Thyrogen is used for, as well as my own personal experiences with Thyrogen, so that you guys feel a little bit more comfortable and are a little bit more informed before having the procedure done. So all of my resources are linked down below as usual for your convenience. So first and foremost, Thyrogen is a prescription medication given in 2 injections by a healthcare provider 2 days prior to receiving radioactive iodine. So right before you're about to be isolated either at home or in the hospital. I was in the hospital. You might also receive this if you are having any other sort of diagnostic testing, if you are a patient with thyroid cancer or any form of thyroid cancer. One thing to keep in mind is that Thyrogen is not approved for people who have thyroid cancer that is spread to other parts of the body. So I've recently learned that a lot of thyroid cancer patients are susceptible to melanoma and vice versa. Melanoma patients are susceptible to thyroid cancer. I'm not sure entirely how this works, but I was Googling this mark on my face, and I am now going to get this tested for melanoma because I'm scared. Even though I don't have cancer anymore, I just want to be sure before I go back to work that nothing else is spread in my body, and you all should do that too. So here's where the price comes in. Thyrogen can be so expensive, especially if you don't have coverage. When I was working, I did not have coverage at all, but since I have been on sick leave, I have been on social assistance, which has benefited me in a lot of ways, one being the coverage and the benefits that I've received. If it wasn't for that, I would not have been able to receive my Thyrogen shots, as they are $1,000 a shot. So for 2 days in shots, 2 injections, $2,000, I would have had to work my butt off, and I was in no condition to work. So honestly, it's expensive, but it's worth it. I am honestly sitting here cancer free, and I had the procedure done. It did save my life. So pretty much Thyrogen helps your body avoid signs and symptoms of hypothyroidism, while still allowing your healthcare provider to remove bits and pieces of infected tissues like cancerous tissues or any sort of thyroid tissues that need to be removed after surgery. And like I mentioned, Thyrogen can also be administered to perform certain diagnostic tests to monitor the recurrence of thyroid cancer. Normally, you discontinue your synthetic hormone or Synthroid for 1 whole week prior to having these injections. It did honestly take quite some time for all of the paperwork to go through for my injections, but the people at Thyrogen were so kind, and they worked with me from day one to pretty much make sure that everything was covered for me. And I do believe that they offer a payment plan, or they have someone who can help you cover your Thyrogen injections if you absolutely cannot pay for it. So I mean, if I didn't have social assistance, I probably would have went through that, and I probably would have got off with paying $100 for both my shots, which is still a lot for someone who is not working and has no income. But I do encourage you to call them or email them, speak with them if you have any questions or concerns. I will leave their website link down below. Go on there, educate yourself on what Thyrogen is, and make sure that you have a awesome experience because it's not really that bad. It's just injections. The worst part is if you're scared of needles because they are that long. I might be exaggerating, but I know they're extremely long. So with my experience, the shots are both administered into your butt cheeks, which is convenient. If you have someone sitting in the room with you, they get a show. The first shot knocked me right out for the whole day. I don't know, other people have different experiences with it. Other people get sick, other people have felt really nauseated. I felt a little queasy, but I fell asleep for the whole day. I was so tired. The next day I had another shot and I was completely fine. I didn't feel anything, but then the day after that I went right in for my radiation. So the people at the hospital who gave me my injections did tell me to either take some Gravol or whatever to settle my stomach and I would be fine for the day, and yes, that does work. And I do want to mention that you would either be going to a hospital or to a doctor's office to have these shots administered, but probably a hospital. I had to be checked in, I had to get a wristband and everything both days in a row, and it was kind of a nuisance to just have injections to go in and out, but you gotta do what you gotta do, right? So I just want to touch on the uses for specific patients, like elderly patients or pregnant patients, just so that in case you happen to be one of these, you are fully aware of what's going to happen with you and your body. So with pregnant patients, Thyrogen should only be administered if the doctor thinks there is a clear concern and need for it. Otherwise, they normally will not give it to you. With breastfeeding patients, you need to be careful because there is no actual link between Thyrogen and breast milk, so there is no way that anyone can tell if it will hurt your baby. So definitely check in with your healthcare provider to see if it's best for you. If you are breastfeeding, maybe this is a procedure that needs to wait. So with children, a lot of studies have shown that this has not been tested for people under 18. It does say on the website that safety and effectiveness has not been established for patients under 18. However, studies do not show a difference in the safety and effectiveness for patients between 18 and 65 years old, so anywhere in between it is completely safe for you to be taking this as long as you are not pregnant or breastfeeding. Check in with your healthcare provider for those two. And last, patients with kidney disease. You have a harder time expelling things out of your body, and Thyrogen is one of them. That will exit a lot slower through your body. So that will lead to you having a higher TSH reading in the long run. So just check in with your healthcare provider once again for that. So quickly, I just want to talk about all the side effects that are listed on the website. The most common side effects in clinical studies were nausea, headache, fatigue, vomit, and dizziness. And I can vouch for almost all of these to happen to you, whether it's the first day, second day. Some may not experience this, but I did. And here's just some leftover information that you guys should know before having Thyrogen. If you are 65 years old with leftover thyroid tissue in your body, definitely consult with a healthcare physician about the risks and benefits of using Thyrogen and having this procedure done. So if you happen to be at risk of a stroke, Thyrogen is given on one side of the body through your butt cheek, like I said, but this can make that side of the body weak and more prone to stroke-like things happening to you. I'm not sure how to put it, but it does warn that on the website, and I just want to make that a clear thing in the video. If you are prone to strokes, especially as a younger woman, be careful with Thyrogen. And last but not least, the first thing they told me when I was leaving the hospital, stay hydrated. This will dehydrate you a little bit, and it always is important to stay hydrated. I mentioned that a couple videos back. Go check that one out. So I just want to thank you guys so much for hanging out with me today and learning a little bit more about Thyrogen and educating yourselves if you are having this procedure done. It's been a while since I made a thyroid cancer video, and you guys have been voting for it every time I put it in a poll on Instagram, so I hope you enjoyed that. Thank you once again for hanging out with me today. You will probably see this look in another video because I am pre-filming for when I have my teeth out. Thank you guys so much for watching, and I will see you in my next video. Sayonara, suckers!